Is arthroscopy the only option if PCL ligament is completely torn? Now, when the ligament is torn, then one thing is sure, that ligament doesn't heal on its own. So if ACL or PCL, any ligament is torn, it cannot heal. But that doesn't mean that all patients who have got ACL or PCL ligament torn, tear, they require surgery. If the patient is not of high demand, he or she is having sedentary life, suppose office going worker who is not into any sports, then if you do proper physiotherapy and you strengthen your muscles, thigh muscles, then you can manage even without surgery. But if the patient is active and if the patient is pursuing any sports, young patients, in those cases the ligament reconstruction should be done. What would happen if you tear all 4 cruciate ligaments of your knee, ACL, LCL, MCL and PCL? Is it repairable? Could you walk or play sports ever again? So knee dislocation is a serious injury in which sometimes all 4 ligaments are torn. Now in this case, the knee becomes very unstable and the patient cannot manage without reconstructing or repairing those ligaments. Now there can be various permutations and combinations, and all of these ligaments can either be repaired or reconstructed based on the requirement of the patient. Now if they are being dealt properly, then definitely the patient can go back to their normal activities or can even pursue sports. After 10 months of ACL reconstruction arthroscopy, a pop sound comes from an operated knee. Is it normal? Sometimes the patient do get some sort of sound after ligament reconstruction. That doesn't mean that there is any problem. If it is not associated with any injury, if it is not associated with any pain or trauma, then it is quite okay. But if it is associated with any instability or pain, then it should be properly examined, and if required, some investigations should be done to find out that the ACL has not re-torn. What if I don't opt for arthroscopy for partial ACL tear and posterior horn meniscus tear? What will happen in 10 years down the line? Sometimes there can be partial ACL tear, but in most of the cases the ACL is either functioning or not functioning. Now if the ACL is not functioning and also the meniscus is torn, in that case there is excessive pressure on the knee joint and it can lead to arthritis in the later stage. So it has been proven in studies that especially if the meniscus is torn, then and if it is not corrected, then in long term it leads to arthritis of the knee joint.